These policies only apply when the regular course of business is not viable due to the current staffing crisis and because individuals that you serve are at risk of losing access to critical services due to one or more of the following situations: lack of staff availability, imminent home closures, absence of other support or living arrangement options, such as with family and friends, or the imminent risk of houselessness or institutionalization, or other staffing crisis related situations that are risking an individual's ability to receive their chosen residential services. Today, we're going to walk through the guide that came out a week ago on the temporary policy and licensing changes. We're also going to talk about a provider survey. There was an action request transmittal that I believe posted yesterday, and someone will come on to talk about that, and then we'll have time for questions. We will be using the chat box to answer your or to see your questions, and then someone will read them out loud for everyone to hear, and then we'll be able to answer them live for you. So please use the chat box to ask questions. If for some reason you don't have access to the chat, please just raise your hand using the reaction button and someone will call on you and we can unmute you if needed. This meeting will be recorded and posted on the ODDS website. Debbie, are you able to start recording before we jump into content?
It is recording.
Oh, great. Okay, it just didn't give me a notification. Thank you. But we will pause for questions after each slide or each section that we talk about, so we can answer the questions that are relevant to the information that was just shared. And then we'll also have time at the end, hopefully, for additional questions that may come to you as we work through all of these. You can find more information about everything we're talking about today on our transmittal page. There's a link on the screen, and if someone can post that into the chat, that would be great. That's the transmittal that went out related to these temporary policies. There's also the link to the worker guide where these temporary policies are explained in greater detail. That's really what we're pulling from and talking about today. And then also a link to our COVID-19 page, which has this information and many other relevant tools and resources related to the COVID-19 pandemic. And now I'm going to pass it off to Jessica Dennison to talk about licensing.
Good morning, everyone. We have a few things to chat about today. The first is around our licensing reviews. We have basically gone to a condensed licensing review process from kind of the standard reviews that we've done in the past. And this is again for a limited time. So for adult foster homes, we will be doing a condensed review. Local licensors at the CDDPs, the Community Developmental Disability Programs, have received a condensed checklist in terms of what they're going to be reviewing. And so they should be reaching out to you guys as providers to let you know what those reviews will be looking like. Child foster home reviews will continue to be the same process. We're not doing any condensed reviews, excuse me, for those providers. And then also, you can kind of see here on the screen we've provided, and this is all in the transmittal and the worker guide as well, but around specifics of what we're going to be asking for. Regardless of a condensed review happening, we still have to receive the application, the fees for beds, and the PEAA prior to the expiration date for us to process as normal. So that is an important point that we want to make sure happens. Let me go to the next slide. And then for, man, I'm having a hard time seeing my screen with all of this stuff on here. Hold on a second. Sorry about that. There's a lot going on. We are aware that you guys have not received a checklist yet for Lane County and other counties. So we are working on that. Hopefully it'll be out today. We will be getting that out the door. Okay, and then if you guys have questions around licensing reviews, we really would like you guys to be sending these to the DD licensing email box. It's really important that everything goes there and not to a specific licensor or staff in the licensing unit, so that we can make sure we're processing requests in a timely manner. We have seen an exponential increase in our workload, just in terms of kind of everything that's been happening, as well as, with the crisis that you guys are dealing with as well. So you guys have temporary requests, you have a lot of stuff that you're asking for. So if you can just make sure you get those things to the DD licensing box, that will be really great. So the other thing that you'll see on this slide is that for 24-hour homes, both adults and children, we will be still doing on-site in-person inspections, and that's the same for foster homes as well. That is a requirement that we have to do for 24-hour. And so we will be doing what we call is kind of a hybrid model. So we'll be doing some remote review portions. We are reducing what we're going to be asking of agencies to send over to us electronically. So hopefully that'll help with your guys' workload a little bit. And then we will be doing that in-person inspection, and we have reduced what we're looking at in terms of the in-person portion as well. Any review that requires a follow-up, we will be using our standard review process. So that's not going to change to our condensed review. And this is all for those that have started a review effective October 1st. So I want to make sure that date is important, just because if we started a review prior, that we're going to kind of be going through our standard review process. Anything after October 1st, we'll be using this more condensed review. And then, of course, we will continue to do reviews for complaints or other concerns that we have received regarding providers. That is, none of this kind of negates that. It doesn't negate us from going out in person as we need to for whatever reason, and making sure whether it's a unannounced visit or a scheduled visit, we have the ability to do either one of those situations. All right, next slide, please. Okay, so this next thing I want to talk about is capacity changes. We have a lot of, just due to staffing issues, we have a lot of providers that are trying to consolidate homes temporarily. And so we are receiving a lot of capacity changes, which is fine. So for capacity changes, we have a new capacity change form, which was attached to the document that was sent out via transmittal. So that new form needs to be completed and then sent to the DD licensing email box. Our recommendation is we really would like the program manager at the local office to have the information before we make any changes. So the form itself actually asks for a formal approval from the CDDP. However, if you're not able to do that just because of the immediacy of what you need to have done, we ask that you just make sure that you put the program manager, the CDDP, on your email when you send it to DD licensing, so that we make sure they're looped in and aware. And we can touch base with them to see if there's any concerns with the capacity change request. For people that are requesting the capacity change to increase to 6 or more, we do have additional questions, and that is in the change in capacity form that was sent out. So that's important that we have that information. There's also guidelines around 6 or more in terms of a sprinkler system needing to be in place and a fire marshal inspection occurring. So if you have questions about any of that, please reach out to us at DD Licensing, and we'll help kind of navigate through what that needs to look like and how we want to do that. Generally speaking, we are trying to limit our approvals to 10 adults in a home or 5 kids. So we will, on a case-by-case basis, be looking at other situations. Okay, next slide. And then I think this is the last thing. So the funding levels. So we are trying to keep the funding levels in place for capacity changes. So if you are changing something, we're doing it temporarily for a 90-day basis. And then if another 90 days is needed, we will look at that as well, and it will be considered. But questions around that should definitely be sent either to me at DD Licensing or to our actually, Caitlin, I'm not sure where we want those questions sent to around funding levels.
I think those should go to the ODDS questions box.
Okay.
And someone can type that into the chat. I can try and toggle over there. But it's the same email box that was on the transmittal, and that's indicated on the worker guide where all of this information is coming from.
Okay, great. Thank you. Thanks, Angela. Next slide. The last thing is for providers. We have a lot of providers that have requested to close their homes. However, we are really hoping that if you can maintain your empty homes and not close them, that we really encourage that. We're trying to really keep the foundation of our DD system in place. even while this sort of crisis situation is happening for folks. So if at all possible, we're hoping that providers can move from, instead of closing, to move their status to active but not serving. And so to do that, I just need an email from the provider specifically to state that you want that to be active but not serving. If at any point you move people back into the home, you have to notify licensing so we can change your license back to serving and make sure your capacity is all set correctly and all that. Again, if you have any questions about that, please reach out. We're happy to kind of walk through what might be the best case scenario for folks as providers are trying to navigate through this part. All right.
Should we check in on questions?
We have a few questions in the chat. People are asking, the change of capacity form was not attached to the workers guide. Was it attached to the transmittal? But I put those links, everyone, are on the ODDS COVID webpage for providers. It's under provider resources. The exception form for CMEs is under that area for CMEs. So I put those links in the chat as well. Next question is, for increases in capacity, how will Express know to freeze the rate? What will be the mechanism for that?
I believe the
Express-
mechanism is, oh, go ahead, Mike.
I was gonna say, Express doesn't read capacity with respect to rates. At this point, Express rates are manually entered by the CME or by ODDS. And so we just won't be changing them based on capacity changes.
Okay, and the next question, I'm not sure I understand your question, Joanne, but it says, how does this affect notice? How does this affect notice? Is the question.
I'm not sure what that means either.
Yeah, I'm
Joanne,
not
do you
sure.
want to?
Joanne, if you could retype it in and we'll get to the next question here. Cindy, you want the active not serving message to come to Jessica, not the generic DD licensing email?
That should still come to the DD licensing email box, please, for processing. We have a couple different people managing that box now to try and get through this stuff as quick as possible.
Yeah, okay. Another question, when moving an individual to a temporary placement, the rate will remain for 90 days despite the number of beds?
Yes, that's correct. And then if another 90 days is needed after that, that'll be looked at.
Yeah. So in other words, increasing capacity won't decrease rates like it ordinarily would.
That's all the questions I see right now in the chat. Do other folks have questions? Okay, here's another question. Does a person's CPA change if they have moved temporarily?
We're going to get to that. It's not a yes or no question. It's whatever may make sense. I'll get to the slide in a few minutes, but as a preview, we're suggesting that CMEs not transfer CPAs, that the sending CME just keeps that person open at their CDDP, as well as keeps the residential CPA there, and work out the courtesy case management arrangements without doing the express work.
Okay, and we have another question in the Q&A actually section. Sorry, I just realized there was two different chat areas on this format. CDDPs have not been looped in on all capacity requests. How will licensing ensure that CDDPs are informed of changes?
Yeah, I would ask that you reach out to me directly about that, because we've been verifying the CDDPs are put on the emails and or that they provided approval on the actual document itself. So if that's not the case, I need to know about that. So please send me an email directly about that situation.
Okay, and one more question. Will you expedite new developments concerning 24-hour licensing?
I'm assuming that means new homes. We are going as quick as possible. Like this week, we have 10 walkthroughs that we're doing for 24-hour homes. I unfortunately, just like most of you, still only have a limited number of staff to be doing the work. And we've had staff out as well. So we are still processing everything in the order received. One thing that I would like to mention is that it is really important that people are submitting completed applications. And that means all the documentation that we need. If we're trying to get a new Medicaid agency, all the insurance stuff, everything that the quicker that we get that, the quicker we can process. Right now, a lot of our lag time is not getting everything that we need in place to process that completed application.
A few more questions came in, Jessica. When you surrender license, there is no appeal process. Will this be the same if you suspend a license?
When you surrender a license, there's no appeal process. Will this be the same if you suspend a license? So the word suspend is confusing me a little bit, because if you move to an active but not serving status, there's not an appeal process, because technically you're still an active provider, you're still licensed, you're just not serving individuals. If we take any sort of administrative action on a license, whether it's a immediate suspension, a revocation, and non-renewal, there's always an appeal process to that. So that will not change in terms of our process at this point.
Okay, two more questions and then we should probably continue with the rest of the presentation. Does the appeals process still apply when giving notice?
Yes.
Okay, and one more, what about 120 licensing?
So we're still doing 120-day reviews for licensing. We are, as most of you are aware at this point, we are still pretty far behind on our reviews for both renewals as well as 120 days. So please be patient with us. We are getting to them. If you have an issue that you're not able to bill because an extension hasn't occurred, it's important that you go into Express and do what they call as a technical assistance request, a TAR, so that they can work on getting that fixed and getting the extension put in.
Great, and it looks like the questions have subsided, so we can continue.
Thanks,
Right.
everyone. If you guys have questions, just send it to DD Licensing. We'll get an answer to you as soon as possible.
Thank you, Jessica. Mike?
Okay, so this first one I'm going to talk about is pretty simple. Variances are approved sometimes that are individually specific. And so to the extent that it makes sense to apply that variance to a temporary setting, it can apply. So there's no need to resubmit a variance request. But we do need to know what's going on. So we're asking services coordinators to update variances and send them into the ODDS variances website or email box. Rather. Okay, so Jessica obviously has alluded to the fact that we know people are going to have to be moving temporarily into other places. Before I start on this slide, two things. The person who is going to present this is out today, so I don't have their notes, what they were going to say. So that said, do not assume that this presentation is a substitute for reading the guides. There's much more detail in those guides than I am going to be able to present here today. So do not consider yourselves fully informed at the end of this webinar without having read those guides. So, all right, that said, people are going to be moving. We want it to be simple. We want to reduce workload on both the providers and the CMEs to the extent possible. And we know that we need to be flexible and fast. So in a normal move, there would be meetings, discussions, choice advising, in-depth planning, and that just may not be possible under these circumstances. So providers will be the ones who know best about what the situation is in any given home. Options for alternative residents include other licensed settings operated by that provider, operated by other providers, foster care providers, family homes, friends, neighbors, anybody where it could be, the individual support needs can be met safely. We're not, almost anything is on the table, quite honestly, when it comes to housing for someone who may be facing homelessness. We do need to know and I say we, CMEs in particular, need to know where their individuals are. Case managers are crucial also to maintaining health and safety. All of these moves are probably going to be upsetting, so there's going to be need for increased monitoring. So communication here is going to be absolutely crucial. Ideally, before a person moves, the case manager will know where they're going to. A few things to consider, though. Anytime you're talking about maybe children and adults living together, that's still going to require permission from ODDS. So that has to go through the variance process. We'll look at them, urgently. So, make sure that they're marked urgent, and we will review them as fast as we possibly can. Shared bedrooms are something to take special consideration for. Obviously, you all know about planning and health and safety and compatibility and conflict, but just consider those things before thinking about asking somebody to share a bedroom. I think we already answered the involuntary exit question. People do still have rights, even though there's going to be some strange situations where people can't be supported in the home they don't want to move from. We're just going to have to deal with those as best we can on a case-by-case basis. One option for providers is if they have a DSP who has a good relationship with one of the individuals living in a home, if that DSP can take in a resident temporarily, of course, that at the discretion of the provider agency can happen. Any sort of compensation to the DSP is between the agency and the DSP. CDDPs should do their best to assure that the site, the home of the DSP is safe and appropriate for the individual. And again, there's a lot more information in the guide on this about precautions and things to consider. Please read that before considering a move like this. But it is on the table as an option.
A pause for questions.
Yes, we have a few questions. I have vacancies available. How do I get notification of home closures and client availability?
I think communication is going to be really, really important here. So I think communicating with the CDDPs, both maybe locally and in neighboring counties, to tell them that you have a vacancy, and then they should hopefully know if there's a provider who's struggling, and maybe they can be the intermediary to connect you, as one suggestion. Yeah, we don't have a system set up at this point for matching vacancies to people who need a place to go. But I think working through the CDDPs at this point is probably going to make the most sense.
Next question is IBLs will still be needed for shared bedrooms, correct?
Correct. All IBLs nothing's changing about the need for an IBL.
Next question. This information suggests that someone other than the service coordinator will talk to the individual about their options. Isn't that the SC's responsibility and role? Wouldn't the provider, oh, sorry, I can't see this whole message. Wouldn't the provider notify the SC before any discussion with the individual so the SC can be involved in the process?
Well, yeah, under normal circumstances, absolutely. But nothing about this is normal. And we're also not suggesting these are good practices. They should be a matter of last resort and in an emergency. But if the services coordinator isn't available to do choice advising before a person needs to move someplace so that their basic support needs can be met, and we can't hang up a person's health and safety on the availability of a case manager to do choice counseling. After the fact, sure, you can have conversations, you can talk it out, but the normal sequence of events may not always play out under these circumstances.
A couple more questions here, Mike. Does the client stay in the current home even if the provider is not vaccinated until an appeal is over?
It's a great question, and I don't think we know the answer to that
Yeah, I
right
don't
now.
know.
That's something we can take back.
And another related question, can a vaccinated employee provide direct care and client stays in the home even if the provider is not vaccinated?
Provider. I lost track of who's vaccinated.
Says, can a vaccinated employee provide direct care and the client stay in the home even if the provider is not vaccinated?
Well, all providers are going to have to be vaccinated by the 18th. So they shouldn't be providing any care if they're not vaccinated. Any employee who is vaccinated can provide care in whatever setting it makes sense to provide the care in. I don't know if that answers the question. I was having a hard time following it. I apologize.
Next question, DSPs providing temporary residential support. Does that include DSPs at a specific residential agency or any DSP, including any attendant care provided for the individual?
Is that asking if other agency provider types like an employment or a CLS provider can do that in-home care? If so, I don't. Sorry. go
Yeah,
ahead.
temporary residential support. Does that include DSPs at a specific residential agency or can any DSP, including any attendant care provided for the individual?
I don't think we talked about other provider types, DSPs being, available resources for this. So we'll have to take that back and discuss a little bit.
Next question, if a DSP or PSW can take in a client, is the payment from a provider at the respite rate? Do these days then count against the yearly respite days allotted to the client?
This is where I wish the original presenter was here today because they know this a lot better than me. We're not considering it relief care. The agency, as long as they're providing a minimum level of support in an alternate setting, can continue to make or claim a day of service. So if an individual, say, goes to the family home, as long as the agency is supporting that family and that individual in that setting, they can claim a day of service. If they're not providing any services or supports, then it's an absence and against the 21 days.
For exits, the next question is about exits. The appeals process is scheduling into December. How do we move forward prior to that date? What if staffing shortages mean that the agency cannot support the individual?
Like I said, we're hoping these are few and far between. Definitely request an expedited hearing. We're pretty sure that those will be honored, so they can move quickly. But yeah, without a specific scenario to go through, which involve your field liaisons if they come up to help with planning if necessary. But yeah, we're going to have to do the best that we can and expedite the hearings and do as best we can to keep people healthy and safe. But I'm not here to say there's not going to be challenges. There definitely will be.
Okay, the next question is why, I don't think, I'm just trying to, sorry, there's just some chat. Who is responsible when some type of abuse possibly happens in a DSP home?
Well, I mean, that would be up to the abuse investigator, but the agency is still going to have responsibility ultimately for that person's health and safety.
Okay. I think that's all the questions right now.
Okay, so I kind of already covered this a little bit. Given the hopefully temporary nature of many of these moves, we are suggesting that CMEs, CDDPs do not transfer people in the express system. Keep open the 48 CPA, keep open other service authorizations, the residential employment, all of that. Just keep it at the permanent residence CDDP. But again, inform CDDPs when there are moves. CDDPs have to know where people are, but Express doesn't have to be the place where they go to find it. Go ahead, Kayla. So that last slide and these next couple are about addressing the workforce shortage at CMEs. You may have seen that we have there was a transmittal that talked about CME staff going and working in residential settings. To the extent that that is happening, these policy options should hopefully free up staff to do those things. So yeah, not engaging in the express system for transfers is one of those measures. This next slide about exceptions is another measure like that. We know that the exceptions process can take some time going through ODDS, and we don't want that to be holding up people's health and safety. So we're turning over temporarily exception approval to CMEs for certain types of exceptions. One of those types is 2-to-1 staffing for in-home attendant care and relief care. One thing to know about these exceptions is they're still going to pend in Express, and only ODDS can override them at this point. It's not an easy thing for us to change that permission. So the process for these exceptions will look like the ISP team will identify a need for 2-to-1, either attendant care or relief care, convene a meeting at the CME, at least involving the services coordinator and the supervisor, compare the information in the reopening guide about the criteria for approving a 2-to-1. If the criteria is met and the services coordinator and the supervisor agree, then there's a form to fill out. Angela alluded to it. Maybe we'll get to it later. It's a simplified exception form, very basic information that identifies the person and why you made the decision that you made. And that will then get uploaded into the person's plan of care. You'll send an email to the FAC, who will then push through to accepted status, basically no questions asked. We're not going to be reviewing your exception approvals in order to push them through, which is not to say that eventually we may not go back and look, but in order to make it happen quickly, they will be approved right away. And again, please read the guide, understand the criteria. 2-to-1 should only be approved to the extent that it's necessary. If a person needs 2-to-1 for bathing, for example, only as much 2-to-1 staffing should be approved to accomplish that task.
Mike, what is FAC?
What does it stand for?
I couldn't remember either.
I'm sorry, I don't remember. It's the person who does contract work in Express.
Funding Allocation Coordinator.
Thank you.
And these approvals are good through the end of the ISP period. If an individual requests 2-to-1 and the CME talks about it and thinks it's not necessary, that person will be required to be given a notice of planned action. The guide cites the OAR that you should cite, but that does come with its rights. It's a denial. Okay. Another kind of exception you can approve locally is additional days of relief care beyond the 14 that are already available. We're hoping that these can be used to prevent out-of-home placements, or that an out-of-home placement is necessary because a provider has been lost, and permanent arrangements can't be done timely enough within the 14 days. So they may need extra days of relief care in order to facilitate an entry into a residential setting.
I'm gonna pause for questions on exceptions. Or
Sure.
This is a question. I'm not sure if it's related. If someone moves from one 24-hour group home to another within the same agency for a temporary move, the CPA would not need to be updated with the site they are at?
Right. But the
And can you-
CDP needs to be informed.
Okay, great. Can you confirm that the 2-to-1 for people in 24-hour and adult foster care still follow the current exception process, i.e. go to ODDS?
I can confirm that is true.
Will the SC or CME be required to complete a second addendum when the individual moves back to the residential home? This is regarding variances.
That I don't know. Anyone else?
I'm not I'm not sure what's meant by addendum.
They are amending the variance when someone temporarily moves to a new setting. So I guess the question is, do they need to amend it again back to the original address when the person moves back? Probably.
I think so. You could check with licensing, but I think that would be the case.
And then RE moves, related to moves, there was discussion by ODDS of a pause on choice moves. Is that still going to happen? Specifically county to county transfers?
I'm not aware of that reference.
Sorry, one more question regarding the 21 days limit on absences from 24-hour group home care. If a person is going to their family or friends for a period of time during this crisis, what modifier should be used for claims?
I don't think anything needs to change. As far as Express is concerned, everything is business as usual, as if the person stayed in their home.
Okay, I think that's it.
So, yeah, knowing that CME staff are sometimes going to be providing direct care, to the extent that we can free up time at the CME, we're temporarily going to allow.
Looks like we might have a mismatch here on content
Yeah,
and title.
Let me get the bullets. They don't quite match the title, do they? What is this one about?
This is about assessors or licensors being able to provide billable case management services.
Yes, I'm wondering what the bullets on this
Oh,
slide are. I
I
don't
can
know.
speak to those.
Okay. Now I'll go over the case management services by other staff. Yeah, well, Caitlin kind of already spilled the beans. Assessors, licensing staff can do case management services. They can do monitoring in particular. So if they're out in a home doing their regular activities, so long as they meet the qualifications of a case manager, they can make claims for case management. I don't know off the top of my head what that means for Express. Caitlin, do you remember we talked about it? And I'm not sure if there was a solution if they already have the ability to do that or not.
They should. They may need new
surrogates.
permissions.
Yeah.
Yeah. All right. And additionally, if a person is currently served in a non-home and community-based services setting, such as a nursing facility or a residential treatment facility, they can access certain services funded through ODDS if that's necessary to move them into a home and community-based setting. So examples are assistive technology, assistive devices, or behavior services. If this is something a person needs to successfully transfer out of that more restrictive setting into a home and community-based setting, you'll need to notify us because it will not be easy or possible to just bill and express for those services when a person is living in that setting. So if you can notify us, we can support you in getting that funded and processed so a person can access those supports and in order to transition into that home community-based setting. Any questions on the last couple slides?
Few questions have come in. Is the process to locally approve extra relief care in Express the same as the 2-to-1?
Yeah, in the guide and on the form, it specifies which exception requests need to come to ODDS just because Express will block them. So yeah, the additional days of relief care and 2-to-1 are going to pend in Express. So those have to be pushed through by us. Those are the ones who need to be emailed to the FAC, the funding allocation coordinator.
Okay, great. Can we review the CME approval of 240 hours for transfer from kids res to in-home? And can this be used for CW clients?
I think we have a slide coming up on that, don't we?
Yes,
Okay,
we do.
We can go, we'll take that question in a bit then. Does this include BRB as in boy, BRS as well?
Yes, it should.
Question.
The child welfare, I cannot remember what the acronym stands for.
Behavior Rehabilitation Services. Thank you for the person that put that in the chat. And final question, what is the email to notify you about the need for ancillary and non-HCBS?
You can email the odds.questions box.
Okay,
It looks like we might have a technical difficulty with getting the second Spanish interpreter assigned. So I want to pause and make sure we can fix that before we move on.
This is Debbie. I do need some assistance here. My screen has only the option to turn it off. Let's see, manage language. There we go. I think I can add her now. Gaia has been added as an interpreter.
No, not yet. Sorry.
You're not on?
No.
Okay, I'm doing one more time. Are you in now?
No, not yet.
Oh dear. Okay, I'm one more time. You should be in now.
Oh yeah, now I got it. Thank you.
Thank you.
Thank you, Thalia and
Thank
Debbie.
you.
Okay. Okay, I can speak to this slide. This is for children that are currently served in children's group homes who are temporarily leaving those settings. We anticipate that some children that are served in group homes will temporarily perhaps move back home to the family home if the family is able to meet their needs. And in these instances, the case management entity, the local level, has the authority to approve 240 hours of attendant care per month by completing the CME exception form. So that form that is linked in the guide, the same form that you would use for the relief care exceptions at the local level, or the 2-to-1 approvals at the local level, can also be used to approve this 240 hours per month of attendant care for children. This basically avoids having to conduct the child's needs assessment before moving them into the setting temporarily. So that approval will speed things up significantly. And then the children's needs assessment should be conducted at some point before the expiration of the child's current plan or 120 days after the move, whichever comes later. So we really want to give you time to get that scheduled, get someone settled into their family home temporarily, and will allow this service level to stay in place for that duration. And let's see, the service level of 240 hours per month may result in the eligibility for that parent to become a paid provider for that child while they're living in that setting. And if that's the case, then that allowance will be in place until the public health emergency ends, the same as for other parents who are temporarily allowed to provide paid services for their minor children right now, who meet that 240 hours a month or above criteria. Questions on this? Our presenter for this topic is also not here today, so I might not have all the answers.
There are no questions in the chat right now.
And I believe I'll be introducing Julie Van Nett to talk about placement planning for children who are in child welfare custody.
Good morning, everyone. So this is Julie Van Nett, and I'm the Children's Foster Care Coordinator for ODDS. And this policy is specific to service planning for children in the legal custody of child welfare. ODDS and child welfare both collaborated on this policy, and we are waiving the requirement of considering placement options in the order of least to most restrictive. So what that means is the team may choose a DD-funded foster care placement without first ruling out the less restrictive option of a child welfare funded placement with DD in-home supports. And the intent of this is really to allow greater flexibility and more timely decision-making so that the team doesn't have to go through the process of ruling out one option before moving to the next. And just a few important reminders, anytime you are, the team is planning services for a child in the legal custody of child welfare, there are always certain things to consider. You want to look at the child's permanency planning goals. If the plan is adoption or guardianship, it might make more sense to choose an in-home plan, and that way there's continuity of services once that child is adopted or the guardianship is finalized. You also want to look at whether there are personal support workers readily available in the area. So if you're considering an in-home plan, but perhaps the family lives in a rural area and there aren't a lot of personal support workers available, the team might want to consider choosing a DD-funded foster care placement. When a DD-funded foster care placement occurs in a child welfare certified home, it's really important to ensure clarity of cross-division rules, supports, and requirements. So it's always a good idea for the child welfare team and the community developmental disabilities team to introduce themselves, explain what their roles are so that the foster provider understands the role of each entity and what the rules and expectations are. And then the last thing I want to mention that's really important is ODDS does not fund relative foster care. So if a foster care placement is the most appropriate placement for a child, but that foster provider is a relative, DD funded foster care would not be an option, but in-home supports could be considered in that situation. Does anybody have any questions?
One question that came into the chat, it might be regarding the previous section, but it says if the CNA results in hours less than 240, do we honor the 240?
We don't anticipate that happening for children that would be appropriately served in a children's group home, but I think we'll have to work through that. I don't think we have explored exactly what that would mean. So it's a good question. Send it to the odds.questions box. Mike, do you have any other answer at this point?
I do not.
That's all the questions.
Allison, are you here?
Hi, yeah.
Great.
Hi, my name's Allison Enriquez, and I'm going to cover the slide related to a provider survey. And so we know this is a really big lift, but it's a really important one. Even in today's chat, we're hearing about existing staffing capacity concerns, but also about existing availability. And so a transmittal went out yesterday, earlier this week, AR 21-088. And it says the ODDS 24-hour for adult and kid residential providers, as well as adult foster care providers, are required to report bed vacancy and staff vacancy. And we're needing that information on a weekly basis. So this is to help ODDS track staffing capacity, potential crisis issues, identify what staffing supports may be available in order to meet existing urgent needs. So to facilitate this, ODDS will be sending out a weekly email reminder to providers every Wednesday. That email will include a link to the survey and then prompt the provider to update the survey by that Friday. And you'll need to complete a survey for each home address and include the bed and staffing data for that home. And this will continue until we send out notification by email that the survey data is no longer needed. And so when this needs to be submitted first, the initial information needs to be submitted by this Friday, October 8th. And we intend to send out our first reminder email to all providers today. And then we'll also need that information on an ongoing basis of at least, when there's a change in circumstances to the home vacancy or staffing needs, but at minimum every Friday. And so if circumstances haven't changed for the week, the provider can go into that survey link and affirmatively acknowledge or submit that there's no change, and only the first survey or the first page of the survey would need to be completed. So again, you can see more information in our transmittal. It's listed in the slide, and it's AR 21-088. And let's see that transmittal, if you want to go take a look at it right now, you can see the questions that you'll be prompted to ask in that survey, so you can be prepared when that email goes out later on today. You can also send any of your questions to our ODDS questions box. And it's been listed in the chat a few times, but odds.questions@dhsoha.state.or.us.
We have a few questions if you're ready, Allison.
Okay.
If a foster provider only serves one person and has no scheduled staff, will they need to do this weekly survey?
They'll just need to do the initial survey and provide that information, and then weekly just select the link and enter no change.
Next question is, for the survey data, are you requiring everyone, even those who are not affected? Not exactly sure I understand the question, but that's what it says.
Yeah, I think probably what they're asking, is if there's no staffing issues or concerns, and we certainly do want to know that. We want to know if there's also availability, but we also want to know if there's no issue at all, so that that you as a provider believe that you're stable. And then what you'll be able to do in future weeks is just select quickly. It should just take a couple of minutes to say no change.
Okay, next question is, what is the format for the survey, and can they keep an Excel file that they update and email out?
Yeah, the current format for the survey is you'll need to enter basically your SBD provider site number that is in Express, and the transmittal has some instructions for identifying that. You can just line those up in an Excel spreadsheet, but right now you need to enter that information into the survey tool, the provider site number, the ID number for that site, and then you'll also need to type in the street number and street name, and then enter just the staffing data. But to identify which address that it applies to, you do need to type in the site ID from Express and also the street address and street name.
How do providers get added to the survey if they are new? And who should the CDDP contact if we learn of an email address change?
We are pulling that information from licensing data. And so when we have new providers come on board, they should come up in subsequent weeks and be getting the email with the request for the link. So they'll be automatically added and prompted to complete the survey. And then the survey also does request that they submit their contact address so we can see if something changes.
Next question, is the link customized for our agency specifically? And can we have multiple people receiving the emailed link?
It isn't customized, so you can forward it on to someone else within your agency to complete the survey. As I said before, what you'll need to have is the site ID for that address, and then start typing in the address information, the street address number, and the street name, and then it'll get linked up. And we on the back end will see that data and confirm that we have data for every site or every address, every home address.
Next question is approximately how long can we expect this weekly survey? I think they might be asking how long they have to do this.
Yeah, we haven't confirmed a timeline, but I think, you know, we need to see how long this, if there's an acute staffing shortage and for how long, and see, you know, what additional steps we can take to definitely alleviate the workload on this. But are anticipating that this will be an incredibly helpful resource in identifying availability.
Next question is the site ID our license number?
It isn't your license number. Let's see if I can get, I don't know if we want to just go to the transmittal and then we can show that there are instructions in there that can show you exactly how to get to the number in Express. So
I put the transmittal link in the chat several times, but I don't have ability to show it on my screen, sorry.
okay. Yeah, I would go to that. And then if you have questions still, contact us, send an email to the ODDS email box. And we are definitely, you know, anticipating that folks might have questions about identifying that number.
I think you answered this one, Allison, but the question is, I assume the original email from ODDS will go to the CEOs. Can we forward the email to home managers or others to complete the info?
Yes, you can forward on to others to complete.
Next question, is it possible for a CME to provide information to you for our adult foster homes each week? This is one way we could assist them during this time.
Sorry, Angela, can you please repeat that?
Is it possible for a CME to provide this information to ODDS for their adult foster homes each week? This is one way we could assist them during this time.
Yeah,
so I think that, yeah, go ahead.
That's something we can take back and look into, but right now we are asking that they submit that information directly. They'll get the email prompt and I'll go in and update.
And then another question, they just wanted to verify that they only have to type in the ID and address the first time. They won't have to do that for every site every time.
Right now it's built so that you do need to type in that information. And so I'm looking at the instructions and it confirms it's the SPD provider ID number for the site and then the street number and street address.
How do we know who is receiving the link email for this first survey?
It should be the contact information for what you have listed in Express.
Okay, I think that's all the questions in here right now.
Okay. We have about 19 minutes left on our time here. Oh, we lost our interpreter, our ASL. I think you might need to pin ASL/English interpreter Ashley. If you didn't have them both pinned, I could still see her. So we do have a little bit more time for our other questions, things we didn't get to today, or things that have just come up.
One question that just came in. For a temporary stay, it can be up to 30 consecutive overnights. Is that correct?
I don't think we put any sort of limit like that on there. Did we?
If it's for staying with our residential direct support professional. I would turn to the guide, and if you still have questions, send an email to that odds.questions box.
Okay, so they verified it's on page 9. She just wanted to make sure she was understanding the guidance correctly.
Ken, do you happen to have the answer to that?
Yeah, I think what that's referring to is with the residential days of service. And I think in the guide, there's a reference to the 30 consecutive overnights and 45 overnight stays in an ISP year. So we can go back and revisit if that's what our intention is, to keep it to that. I think we're just hoping that the crisis, we wouldn't have very long periods of crisis in this. So.
So there's just one suggestion in the chat to consider an Excel spreadsheet that's updated weekly for this survey. They believe this current method will take a significant amount of time when they're already stretched so thinly.
Thank you,
And I'm
Sarah.
just putting the email again for ODDS questions in the chat. If you have additional questions, please, or any specific questions that we weren't able to answer here, please send those questions to that email. There's no other questions in the chat, Caitlin.
Okay. Well, thank you all so much for giving us your time today. And thank you to Debbie for hosting us. Thank you to our interpreters, and thanks for all of our speakers sharing information. Appreciate you. Have a great day, and please send us your questions.